Okay, now what we'd like to do is to demonstrate a manipulation for an L3, L4 flexed and rotated side bend left, but in this case it's locked open on the right side. So we'll place the right side in an uppermost fashion and use a primarily side shifting force to close the open facet. Okay, to actually carry out this manipulation, I have my patient lying in a supine position. I'm going to ask her to turn on her left side with the right side uppermost, because the right side is the locked open facet. So first thing I'll do is I'm just going to palpate here at the L3, L4. So it's an L3 dysfunction. So I'm going to bend the knees all the way up and flex the hips up until I can feel motion at this level. I'll ask my patient to straighten the lower leg. I'll drop the dorsum of the uppermost foot in the popliteal surface. I'm going to bring the leg into I'm just going to straighten it. I'm not going to put excessive flexion because it's a flexion lesion. I'm working into barriers. I place my finger here on the L3 just for palpatory purposes. Place her hand on her waist. I'm going to take her arm just above the elbow. I'm going to rotate all the way down and lock everything up above that. And I'm also going to pull towards the head of the couch a little bit to bring in an extension because it's a flexion lesion. So I'm working again in creating more barriers. I get you to hold your elbow here like that. Slip my hand through here like that, or thread it through. Relax everything. Fix the shoulder and stabilize. Get into my fighter stance. I'm aiming at the segment, so L3 and L4, rotated side bend left, but again locked open on the right side, on the uppermost side. So I want to use a primarily side shifting motion to close that facet. Again, you use whatever vectors you need, and that's a proprioceptive skill which you'll develop with time, but primarily for the purpose of teaching, it's going to be a side shift to close. Deep breath in and breathe out. And that, everybody, is the adjustment or manipulation for an L3 ERS or FRS left locked closed on the right side. Thank you.